Okay.
Mute those, Barnabas.
Yeah,
Thank you.
jail for 11.
Well, for whatever reason, this is not. YouTube and Zoom both changed. My apologies to the audience. YouTube and Zoom both
YouTube
changed.
is okay.
What's that?
YouTube is there.
Marianne, to confirm on my side, I can see the channel open on YouTube now.
But,
It is there.
okay, so something's going. Huh, okay, I can hear it. Okay. Okay. Okay, so it looks like we are live. So again, my apologies. Okay. I can hear the echo back to me. So
I think the echo is with you because I don't hear anything to me. It is clear.
Yeah, YouTube is okay. It is streamlining.
Live.
Yeah.
okay, I'm getting the feedback from somebody, but it is on. If God, when you say it's gone, then let's.
Yeah, I have checked it. It was there.
Okay, then let's move
I
forward.
think also I was the one bringing the echo in, but I was there.
Okay. Okay. Barnabas.
Hello.
Okay. Please turn off that the audio from whoever is feeding back through the system.
I can see you, me and Godwin. The rest are muted. I think we are ready to go. Good evening, everyone. I want to welcome you and thank you for joining us on our fourth webinar, teaching about the details and about lightning. Let me not talk about the details, but about lightning. So for today's webinar, we are again lucky to have Dr. Professor MACooper, who is going to take us through the medical effects of lightning and how to respond to lightning victims. So let me not take a lot of the introduction. Those of you who don't know me, I'm called Barnabas Akantambra, the country coordinator for ACLENet, Uganda. I welcome you, Dr. MACooper, for tonight. Thank you.
Thank you. I don't know if the rest of you are getting feedback from this. I'm hearing what you just said, Barnabas, as an introduction. So somewhere the audio is coming back through. But regardless, let's maybe I'm just the only one hearing that. So I will move forward.
Let's first hear from the rest. If any of you is hearing that echo, you can let us know. And if it is clear still, you can say it is clear.
Hello, this is Kriana Camillus from Rockview.
Yes.
I would think maybe that the echo could be as a result of some people not muting their microphone. But me, it is clear to me.
Yours is clear.
Maybe if Mary Anna is talking, let other people mute their microphone. Thank you.
You're welcome. Anyone else who's maybe having anything about the echo?
Personally, I have no echo. I hear everything very well.
Okay,
Thank
thanks,
you.
Tony.
I've muted my
Thanks, Tony.
voice. I've muted my video as well.
Thanks,
Thank you.
Tony.
You're welcome.
So I think you can proceed, Mayor Anna, since we have discovered that most of us are okay.
Okay. Very good. Thank you for the feedback from everyone and for the assistance on this. Okay. See, I'm still getting it for me, so I'm going to have to try and ignore it and hope it doesn't tape over itself. Oh, okay. Okay. Well, welcome to all. Again, our apologies for the technical problems. This is maybe I'm the only one getting the feedback, but I will just keep talking right through. Okay. Okay. So this is the, I believe it's the 4th or 5th in our webinar series for educating the National Advocacy Team and the others. Welcome to the people from the Board of Directors who are with us. Welcome to the staff that are with us. And welcome to everyone that's streaming on YouTube. Okay, let me open up the PowerPoint. Okay, can you see the PowerPoint now?
Yes, MACooper.
Wonderful. Thank you for the feedback. Okay, so let's talk about the medical effects of lightning. Okay, the outline is I'm going to introduce myself a little bit. Of course, we always go over the ACLENet mission. There's going to be a very brief review of the mechanisms of injury that we've hit in the past. Then we'll talk about the medical effects, the immediate and the long term, and what you can do to respond if you're at the scene of the injury. Lightning is not a burn injury. You don't have to be worried about somebody being terribly burned and doing something like that. It's a nervous system injury. We'll talk about that. If we have time, we'll talk about lightning burns. They're quite superficial and minor. There will be 2 or 3 times during this talk when I stop to take questions, and Barnabas and Godwin are going to facilitate those from the chat box. So you can either raise your hand or, and hopefully they'll pick that up, or you can put something in the chat box. Okay, so I was trained as a physician and my specialty is emergency medicine. I started in emergency medicine when it was actually before it even was accepted as a medical specialty. It was an outcome of the war in Vietnam, actually, when the physicians returning from Vietnam found that the survival rate from the soldiers being injured in Vietnam was actually better than the survival rate from people in auto accidents in the United States. Anyway, so I helped found emergency medicine and wrote some of the training standards and those kinds of things. Around 1990, I began working with meteorologists in the USA Weather Service, actually a trainer for the Weather Service in lightning and lightning injuries and how to prevent them. And I started working with the international lightning researchers on lightning injury prevention and safety. And many of those people are on this call or have been given webinars in the past or serve on other advocacy teams. About 15, 16 years ago, I retired from clinical practice at the University of Illinois, where I was a full professor of emergency medicine. And a couple of years later, I was invited to Nepal as a lightning expert to a lightning meeting and met Richard Shimurari. Well, Richard was so upset by the number of people who he had found were killed by lightning in his in Uganda that he decided he was going to go back and do something about it. And that's exactly what he did. He went back to Uganda, organized a couple more of the similar kinds of meetings, and this resulted in the foundation of ACLENet in 2014. Zambia was our first, was the second country where we were going to be doing lightning injury prevention. But for lack of staff, for lack of colleagues, for lack of money, they have not been very successful. So since 2014 to the present, I've been the director of ACLENet, as Richard asked me to be. But I continue to publish and to present research at international meetings. I've been to Africa 8 or 9 times now, 7 of those for ACLENet, 6 of those to Uganda. I've got a 30-year experience, 40-year experience now with lightning injuries, and I'm recognized as the international authority on lightning injuries and injury prevention. Okay. Just to review very quickly the mechanisms of injury here. As you will recall from the past lectures we've given, ground current here, where lightning hits a distance from a person and then injures them, is the largest killer of people. Second is probably upward streamer, where energy is induced in the person by the electrified cloud going across them. There's side flash. There's a direct strike, which is what most people know about. But as you can see, direct strike makes up a very small proportion of the people who are killed by lightning. Contact voltage is another thing where you're actually holding on to something like plumbing or wiring that's hit as a distance, perhaps far away from the building where you may be inside that building. This is not so much in Africa because we don't have a lot of indoor plumbing, at least in the rural areas. And then there's a barotrauma where lightning comes down. It's an explosive effect as it expands the air, and that can injure someone. Now, these are the mechanisms of injury. These are all mechanisms of lightning injury, but the proportions of these are the numbers that we get from reading the reports in the developed world. I can't tell you what the percentages of these are in the developing world, like Uganda, across Asia, across the rest of Africa and Latin America. One of the things I would like to suggest is side flash, which in the United States and developed countries is very often from trees that people are standing under to keep from getting wet, or perhaps from TV tower or another person or something like that. I would suggest in Africa, particularly in Uganda, where we're taking care, trying to protect school children, that this is because the metal roof for many of the buildings is what is struck. And then there's side splashes or sparks or the lightning actually coming down and getting the people that are inside those structures. Okay. So what to expect after a lightning strike? If you're in the area, someone gets injured by lightning. Well, first of all, you don't need to know the mechanisms of injury to take care of the person. You take care of whatever injuries you see. It doesn't matter what the mechanism of injury is. The mechanism is something that we use for safety measures and for prevention and planning prevention. So don't worry about the mechanism of injury. Well, there's immediate and delayed effects with lightning. As with many things, if you break your leg, you know what happens initially. But then how about as it heals and then afterwards when you're left with a limp? Those are the delayed effects. So let's talk about the immediate and delayed effects of lightning. First of all, at least in developed countries, death only occurs in about 10% of the people who are injured by lightning. 90% survive. But again, this is in the developed world. It's unknown what it is in the developing world. And that's part of the research that we certainly can look at. Survival, unfortunately, often brings after effects that may be disabling and permanent in up to 70% of the survivors. Again, lightning is not a burn injury. We'll talk about that later. Lightning is an injury to the nervous system, primarily to the brain and also to the heart rhythm. which causes the cardiac arrest. Okay. So what are the immediate effects when somebody's injured by lightning? Often they will become unconscious. As they start to wake up from their loss of consciousness, they may be considerably confused. Any burns that they have generally are quite minor. Minor, at least from my standpoint as an emergency physician. They can heal on their own with hardly any care at all most of the time. The person may also experience pain, and they may experience amnesia for the event for up to minutes or hours afterwards. So even a few days afterwards, they may not recall exactly what happened. This also is true for witnesses. We recently did send a team out to the refugee camp near Palabek to investigate the lightning strike that killed 14 people and sent many others to the hospital. The witness, one of the primary witnesses who came forward to help us and tell us the story, really was unclear about exactly what happened. And he tried to put together as much as he could, but he had also been injured and was unconscious for a while. So while we appreciate everything he said and certainly what he did for the survivors, we don't know if that's exactly what was happening at the time. Okay. Not to say that he made anything up. He was doing the best he could. So we appreciate that. A couple of other things that can occur very frequently, up to 2/3 of the people who were injured, and certainly the witness at Nebi said this happened to people, is what's called coronal paralysis. Now, corono is Greek for lightning. So it's a particular kind of paralysis that occurs after lightning. It results in the inability to move or paralysis of the legs. That's more frequently encountered than paralysis of the arms, but both can occur. Now, the person continues to breathe and may or may not be as reasonably alert as can happen after a lightning injury, but they may not be able to reach over to help a colleague or one of their friends who was also injured. They may not be able to escape a dangerous area. And this can last for seconds to minutes. It's a peculiar thing. Another thing that can happen acutely or at the immediate time of the injury is cardiac arrest, where the heart stops or where breathing stops. Okay. So what do you do? Well, first of all, call for help. Get somebody else to call while you're rendering aid, because you're going to need to evacuate any seriously injured person to a higher level of medical care than you can provide at the scene. But usually. Sometimes minor injuries are very minor and they don't need to go to the hospital. But a lot of times they're more serious than you can handle. Another thing, remember to stabilize the scene. If you're still in an active thunderstorm, then you and all the rescuers and the other people in the area are also vulnerable to a lightning strike. So you need to follow the rules for lightning safety, which is to find a safe place, if there is one. And I realize that through much of the developing world, there is no place safe anywhere close to you. So do the best you can. One of the rules of emergency medicine is create no more victims. And that's why we say protect yourself. Because if you go out into a thunderstorm to render aid, then all you may do is become a victim yourself and then create even more problems for the other first responders. One of the rules of medicine, too, is cause no harm. So let's look at what that means. Well, what do? It's very easy to remember this. You look at the ABCs. Number one is the airway for A. You clear the airway. But that does not involve trying to stuff something between the person's teeth or anything like that. All you do is break the teeth. So, but clearing the airway can be life-saving. often all this is going to require is turning to the side, turning the person to their side so that their tongue, which, as you know, if you're snoring, it's because when you're asleep, your tongue relaxes, the muscles relax, and your tongue falls into the back of your airway. If you ask the person to roll over, lots of times the snoring is going to disappear, at least for a while. So turn the person to the side. Often that will help the tongue to get out of the airway and make sure they're breathing. B is breathing. That's the second thing. So the ABCs. Noisy breathing always means obstructed breathing. So if the person is snoring, making a lot of noise, that kind of stuff, that is noisy breathing, and it means obstructed breathing. Okay. With a cardiac arrest, you know, I know some of our staff have wanted me to teach them CPR and stuff like that. And CPR can certainly, cardiopulmonary resuscitation, CPR. CPR may be life-saving, but I think you have to look at what's going on in the area, in your immediate area for medical care. CPR is a stopgap until you can get the person to an advanced medical care center where they can do a more definitive airway, where they can give medications if needed to get the heart going again or to stabilize the rhythm. Otherwise, if you're doing CPR in an area where there is no advanced medical care, not only can it be futile, but you have to think about whether the other bystanders are going to think that you're doing something improper to their neighbor or their son or their relative. And I don't know the social things of that in Uganda. That's something that you all need to discuss and think and know about, maybe advise me and teach me about. Okay. Another thing is if there's multiple victims, how long is it going to take the person to be transported to more definitive advanced care? If it's a half an hour or an hour, you can't do CPR for an hour and it's not going to be effective. The brain's going to be dead by the time they get to this advanced care. Now, there's a difference between whether you have one victim or 15 victims. If you've only got one victim, then you may have enough manpower to trade off and do CPR on the person. But if you've got multiple victims with cardiac arrest, it's probably not, you probably aren't going to have the manpower to address all of them. So these are all situations where you worry about CPR. Now, one of the questions that my friends and colleagues and things where I've been in a CPR situation, like in our church recently, we had somebody who we actually had the minister who was doing the funeral go down and have a cardiac arrest right up there at the pulpit. Well, several of the people afterwards said to me, well, I'm afraid to do CPR because what if I hurt them? Well, number one, they're already dead if they're in a cardiac arrest. So you can't really, how are you going to make them worse than already dead? Okay. So doing CPR on a person, even if they have a heartbeat, is not going to hurt them. It may break a few ribs, but it's not going to, there's no need for you to be guilty if you started CPR on somebody who's gone down. Okay. That person needs to be muted, please. Okay. So if you do CPR on somebody who has a heartbeat, you're not going to do anything to their cardiac rhythm. Like I said, you may break a couple ribs, but otherwise, go for it. They can't be more dead than dead already. Now, what do you do if 10 or 15 people are injured? Barnabas, can you please mute that person? So what do you do if many people are injured? Well, there's this thing called triage. Tri means three. It's a French term, and it means to divide into three different levels of care or what kind of care is going to be needed. Serious people are those who are likely to die in a normal triage situation. Say you have 100 victims. With those who are most seriously injured, you're not going to spend time trying to resuscitate them because that's going to take people and resources away from those who actually can benefit from care. So the moderately injured are the ones that need care for survival or to decrease complications. The minimally injured are what some people call walking wounded. They may not be walking. They may be on the ground, rolling around, talking, groaning, breathing, confused. But care for many of these people can often be delayed until the more seriously injured can be cared for. Now, in lightning, you may hear the term reverse triage, because this is for multiple people who are injured by lightning in the developed world. Turns out that with lightning, anybody who is moderately or minimally injured is going to recover. They may have after effects, but you really don't have to do anything with them immediately. They will recover. The ones that you want to take care of are those who appear to be in cardiac arrest, because you may successfully bring them back. I hope I'm not confusing you with all this discussion of CPR and what to do and what to think about, but I don't know how to advise in the developing world. You all are still teaching me a lot. Okay, so for the less seriously injured, you're going to do the ABCs. If somebody has corona paralysis, you may have to remove them from danger. For instance, if the building that they're in has caught fire. If the person is confused, just keep them safe. Keep them from wandering off, or getting injured, or they require minimal care. So why did I leave out the moderately injured in Uganda? In the developing world, and certainly in Uganda, and from reading all the news reports, what I see is either immediate death or I see the walking wounded. I don't see moderately injured in between. It's either the ones that are going to recover and be able to walk around and talk and do all the things that a normal person can do, or they've been killed. Okay. So questions before we move on. Questions of what I've said so far. Barnabas, Godwin, can you advise me?
Yeah, thank you so much, Mary Anna.
And then we'll move on.
Ask your questions by either raising your hands or you can write your questions in the chat box, and then I read them directly to Mary Anna and she answers. So if you have any question, please ask.
Barnabas and Marianne, there is a question on the chat about just some more information about what CPR is. What does it?
Okay. Cardiopulmonary resuscitation, or CPR, is where you're actually actively breathing for the person by breathing into their mouth, and you're also pushing on the chest to cause cardiac compression. To enable at least some circulation. The most important organ in the body is actually the brain, and without oxygen, the brain's going to die. So we try to keep the circulation going so that we can save as much brain as possible. It's called time equals brain. Okay, so CPR is meant to cause circulation, at least some circulation, so that you keep the brain alive. I cannot teach you CPR by Zoom. I cannot teach you CPR from a distance like this. If you're going to learn CPR, then you need to find organizations within Uganda that are going to teach you the standards that are acceptable in Uganda. Yes, I'm an emergency physician, but I haven't been certified in advanced cardiac life support since I retired. And I don't know the most recent standards because they do change. So that's cardiopulmonary resuscitation. You may see it on TV, but please don't do it the way they do it on TV and in the movies, because it's pretty bad. So get yourself a training session. Okay, more questions?
Godwin, is there any question on YouTube?
If not, we can move on.
I think let's move on.
Okay. Okay. So what are the long-term effects? You know, in the developing world, and certainly the newspaper reports and the discussions that we have, the things that we talk about, we only talk about death. You know, we only talk about the people that are killed, and that's what makes the news. You don't see reports of the person who's recovered and is 2 weeks later or a month later. Well, those are the long-term effects that I really get concerned about, because 90% of the people who are injured by lightning survive. But they often have long-term disabling effects, and one of those is brain injury. If you've read or heard anything about the brain injuries that the footballers get from the numerous times they bang their head into somebody else with football or falling, or my daughter actually had a brain injury because of soccer. She was a goalie, and as she was diving for a ball and rolled over, the back of her head hit one of these support pipes for the goal, the nets. And even though she didn't lose consciousness, she had significant brain injury and months of recovery. That can happen to our lightning survivors as well. They can have significant brain injury. Initially, they may have confusion, forgetfulness, sleep problems, and GI problems like gastrointestinal problems, lack of appetite or nausea for days to weeks. That's because of brain injury. Okay. They may also have headaches. They may have sensitivity to light and noise. I will remind anybody who has read the report from the Nebby investigation that gentleman who helped us, who was the witness and was the first responder on the scene to help people, the people who were killed, who were injured or killed, he is now saying he has sensitivity to light, to the sun. That's very common. That's post-concussive syndrome. People may have trouble with word finding problems, completing sentences, those kinds of things. They may also have difficulty with balance and ringing in the ears. The nerve that goes from the ear to the brain carries both hearing and balance. So that nerve can be damaged and cause permanent ringing in the ears. Because of the difficulties with the balance, people may have trouble in the dark because they don't have the visual cues anymore. They may have difficulty climbing stairs. Our daughter had problems and nausea climbing stairs for 6 or 8 months after her brain injury. So it became very personal when my daughter had the brain injury. This is a great quote that I came across in someone else's lecture many years ago. And it really explains how people are after they've been injured. When I was in practice, I would get calls from people who had a daughter or a husband or someone else who was injured by lightning, and they were just beside themselves. They couldn't understand what was going on with their loved one. They were doing the best they could. And I would read them this quote, and they would say, yeah, that's exactly what Jack's like, or that's exactly what my daughter is showing. So we call it minor brain injury because major brain injury is where somebody never wakes up again. Okay. So it's called minor brain injury by the neurologists. And after a minor head injury or brain injury, they have difficulty in all areas that require them to analyze more items of information than they can handle simultaneously. You may be used to walking down the street and you can see and feel the air and the sunlight and the trees and the leaves moving and the cars coming and going, and you're talking to the person that you're walking with, and you're multitasking. You're doing your brain is filtering out and processing lots and lots of different input. Somebody with a minor brain injury will not have the capacity to handle all of these things simultaneously, like you've been used to doing. People with a minor injury, brain injury, can present as slow because it takes longer for chunks of energy or information to be processed. They can present as distractible because they can't filter out all of the noise and other stuff that's going on around them. And so they get distracted and they don't finish whatever the task is that they're doing, which can be really irritating to a wife, for instance, or a husband or a parent. They can present as forgetful because while they're concentrating on one spot, one task that they're doing, they don't have the processing space to remember the other things that are going on that they were supposed to remember. They may not remember the appointments they've got. They may not remember to turn off the stove. They may not remember to close and lock the door. They can also present as inattentive because of all these distractions and whatever. They don't appear to be paying attention to you or to the task at hand. So that's one of the best explanations I can give of what somebody's like after a minor brain injury. So they can have problems with multitasking and organizing for adults, trouble with forming new memories and learning. They may have trouble with retrieving stored information that's in their brain. So they may not, like I said, they may not remember appointments or things that they were planning to do that day. This often results in being unable to return to their prior work. If they were handling multiple kinds of things, say they were a dispatcher for a taxi company or something like that, or they were the bookkeeper or secretary at a government agency, they may not be able to do all of those pieces anymore, and so they may not be able to perform their work. Well, that means that person is no longer bringing in an income. That means they may lose their mortgage. It means they may not be able to feed their family. It can be tremendously debilitating. Now, for children, they can have learning disabilities that they may have been very good students before, but they may have trouble with all of this brain processing and memory and learning new things. One of a principal of one of the schools where we have installed lightning protection has spent some time with me. She was actually injured by lightning when she was about 10 years old. And as a result, she had to repeat that year of school. And to this day, she still has chronic pain because of her lightning injury. Okay. Well, if you think about all of those things that we talked about in the last slide, the distractibility, the frustration, and all that, the person can become very frustrated because they can't do as much as they used to do, but also because of the caregiver's reaction to them. It can cause a lot of irritability and quick to anger in the survivor, and that often causes difficulty in relationships. So that's one of the reasons people would call me, is that they had just gotten to the end of what they could deal with their relative who'd been injured by lightning, and they were just ready to strangle them. You know, they just didn't know what to do, and so they were looking for care, and that's because of the irritability and anger. And who is a person going to strike out first? The survivor is going to strike out first. Strike out at the individual that's closest to them, their wife, their parent. Okay. Now, the other thing, other type of problem that we get is chronic pain. And that's because nerves are injured. Chronic pain is defined as pain that lasts for more than 3 to 6 months. It can be described by different people use different adjectives to describe it: aching, burning, stinging, sharp, numb, pressure, all kinds of different words, but it's all the same kind of thing. Now, the brain knows what part of the body an injured nerve goes to. There's one nerve that goes from your spinal cord down to the end of your fingertips in your arm. Now, that nerve it's not a series of cells that interact with each other. It's one long nerve cell that goes to the end of your little finger, for instance. Okay. Well, your brain doesn't know where that nerve was injured, if it was at the finger, if it was the wrist, elbow, armpit. All it knows is that nerve is sending signals to it that say pain, pain, pain. So your brain is going to say, that nerve goes to my little finger. So it's my little finger in my hand that's hurting. Even if that's not an area that you may see as a damaged area from the injury itself. That's just the way the nervous system works and the brain works. So the chronic pain may not appear to be in where the damaged area at the time of the injury was. Now, if there's no good medical care for the pain, and at least in the United States, this may the pain care may require multiple medications to address the different aspects of how pain is felt. So if people don't get good medical care, often they'll self-medicate. So they may self-medicate with alcohol or other remedies or even hard drugs. So if somebody's been injured by lightning and they have chronic pain, when you encounter them a year or two after their injury, you may see significant dependence on alcohol or other remedies that they've come up that help numb the pain. So don't judge them too severely. Okay. So damaged nerves, one of the other problems that causes this chronic pain is that damaged nerves heal differently than they were prior to injury. Just like when you cut yourself and you have a scar afterwards in the skin, and that part of the skin is thinner than normal skin. Well, when nerves heal after they've been injured, they become more irritable. The nerve endings, the little it's almost like the end of a feather, the way nerve endings are. Well, all of those little pieces of that feather become more irritable. They can become more numerous, and they can also irritate other nerves around them. So sometimes people who have chronic pain develop what we call a neuropathy. Neuro meaning nerve, pathy meaning bad or ill or injured, okay? Neuropathy can involve where something that doesn't normally cause pain, for instance, air blowing over your skin or light touch, or just clothing or glove, may be experienced as very painful because every time that those damaged nerves receive any kind of signal, it may be a very minor signal, but they receive that signal and they go, oh my gosh, this is awful. And they send signals to the brain saying pain, 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 pain. So that somebody that develops a neuropathy can have not just chronic pain, but chronic severe pain because of the way the nerves heal. Okay? Eventually, the brain areas that interpret and receive these signals can also change. Okay. Okay. Some of the other things that you'll see are a post-traumatic stress disorder or a post-traumatic stress syndrome. And you don't need to be injured to suffer this. This can be from the bystanders. It can be from the family members. It can be from a lot of people in the community because so many people have been killed or injured by the lightning strike. This can cause people to not want to talk about it. They can become very frightened of thunderstorms, which with good reason, obviously. The criteria for post-traumatic stress syndrome is exposure to a traumatic event, whether that's you individually suffering that or whether you are witnessing what other people are going through because they have been in that traumatic event. It can have, a person can have nightmares, flashbacks, distressing memories. They often will avoid whatever it was, avoid the thunderstorm or avoid talking about the event. Sometimes they will even have problems because PTSD sort of causes a little bit of minor brain injury. It can cause the memory and distraction, negativity, all kinds of things like that. And the person with PTSD may have exaggerated startle responses. So you just get close to them and they jump. You know, they may also have anger, because anger is a way of pushing away things that frighten you. Anger is a response often to things like embarrassment or fear, or so anger is a secondary emotion to some of those things that people are feeling. Okay. It's defined as PTSD if it lasts for more than 1 month and if there's functional impairment. You can Google a lot more about PTSD, but expect PTSD in the community. You will see it, and so be sympathetic to it. Questions before we move on?
Thank you, Mirana. There is a question here. How are the medications used to treat lightning injuries different from those used to treat other types of electrical injuries or burns?
Okay, that's good. Okay, what are the medications used to treat lightning injuries? First of all, there is no medication or treatment that we know of that will stop the cascade and the progression of the damage that was started by lightning. So that you have the immediate effects, but there's nothing that we know that can change those long-term effects, the brain injury, the chronic pain, those kinds of things. There is some suggestion in the burn literature. There's good evidence in the burn literature for regular burns that non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, naproxen, those drugs, and some of the antioxidants, vitamin E, vitamin C, may decrease this, and certainly they decrease scarring in regular burns. There has been no studies that can show one way or another that they have decreased the outcomes, the long-term outcomes of lightning injury. However, with the people that I see, I tell them to go ahead and take these in the regular doses, not in extra big doses, just the regular doses that you would normally take them, because they don't really cause a lot of harm. So if they might help, then go ahead. But there's no magic medications or treatment that we have that will stop the progression to the long-term injuries. Now, for chronic pain, there are a number of medications that may be necessary. Again, we try to stay away from narcotics. Narcotics are a very short-term drug that can be used for pain immediately after a surgical procedure, for instance, for a day or 2 or 3 or 4, but not on a long-term basis because of the problems with addiction and other side effects of narcotics. So we may use gabapentin. It's also called Neurontin, at least in the United States. I don't know what it's called in Uganda. Gabapentin fools the brain into not paying as much attention to all of those misfires of those damaged nerves that are sending the pain signals to the brain. So the brain actually sits there and goes, I'm getting all these signals from those nerves, but you really don't care as much about them anymore. Okay? So that's one of the drugs, and that's sort of how it works. Certainly for pain, you can use the non-steroidals again. Tylenol, acetaminophen, paracetamol is what it's called in many developed countries. It's a great drug. One of the things you have to realize is that any pain medication only works in about half the people that take it, and it only works to decrease pain by about 30%. So if you've got a very minor pain from where you stubbed your toe, aspirin, Tylenol, ibuprofen, Advil, maybe all you need. But if you've got severe chronic pain, you may need a number of pain medications that have different mechanisms to kind of attack the pain from a lot of different angles to get it down to a manageable level. That's something that a pain doc is going to have to help you with, or your primary care physician, your family medicine doctor, your internist, somebody, or a post-trauma surgeon, that they will need to help you manage. It's not something I can do over the internet. Okay. More questions?
Thank you. Goodwin, do we have any question on YouTube?
Okay. Since there's
I think
no,
we can move on.
okay, no more questions.
One question
Lightning burns.
from
Okay, go ahead.
Go ahead.
there is one question here which is saying that is it safe to touch someone struck by lightning?
Absolutely. Lightning, as you know, is incredibly short. It's so short and it's gone. It's safe to touch anybody from lightning, and please go ahead and render care to that person, because it may be life-saving. Do not wait for all kinds of rituals and things like that to be done, which is something, I don't know if it happens where you are, but where you live, but I've certainly seen it in enough news reports where the care of the person has been delayed because somebody comes in because they have to do some kind of rituals to dispel the demons or whatever is what they think is the cause of the lightning. But it's perfectly safe to touch somebody who's been injured by lightning. Yes. Lightning doesn't stick around in the person. It doesn't stick around in the surroundings. The only, I will say, however, I've had a number of people who have approached their car, which is metal, and touch the car, and they get a little zap because of the charge that has been built up or induced in the vehicle. That's not a lightning strike. It's just a little bit of static charge. And it's not a lightning injury. No more questions? Okay. We really don't have time to go over lightning burns, so let me just say that the burns that you get from lightning are very, very minor, at least from a medical standpoint. Let me go through very quickly here and show you the one exception to that is lightning is not a burn rule. And we have had a number of news reports talking about people being charged and charred, burned beyond recognition. Now, remember this coronal paralysis that I told you about? It's the temporary paralysis where somebody can't move an arm or leg. Well, it can prevent even healthy young people from escaping burning buildings. For instance, in Colombia, South America, 11 tribal elders were killed in this thatched building when lightning hit and caused coronal paralysis in the people that were there as the thatch was burning, and so they were burned alive. That's the one exception to lightning being a burn. Otherwise, the burns are minor and they require the same kind of care that you do for any other minor burn, but they don't need any. Burns are not going to be the reason that you're worried about the lightning victim. It's going to be all of the brain injury, the chronic pain, the cardiac arrest that they may suffer. Okay. Any other questions?
There is one question which I met in a certain group which I met to talk to, and this question was in some of the communities they believe that after lightning it comes for the second time, or there is another strike that comes after. It strikes twice at once. First strike for the first time, then for the second.
Very good question.
So
very good question.
How long should one take?
Okay, I have not had that question before, and it's a very good question. Okay, so if I'm saying it right, then the question is, whether the lightning hits and then it hits a second time. And well, that's because if you're in an active thunderstorm, lightning is going to be striking all around. And that's why I said protect yourself. In a thunderstorm, even the rescuers are still in danger. So anytime you can hear thunder, you're already in the danger zone. So lightning hits, it doesn't matter whether you're talking about lightning, whatever your beliefs are, the weather is going to do what the weather is going to do. Thunderstorm is going to hit, is going to continue. The lightning is going to hit wherever it's going to hit. And it's likely that there's going to be more lightning strikes in the area if it's a very violent thunderstorm. So that's just to be expected from how thunderstorms work. It's not a result of anything the person has done, anything that the rescuer has done. It's just the weather. Can't do much about it. It's just the weather. Other questions?
So how long should someone wait to reach to the scene or to the place where lightning has struck? Should the person first wait to go there after the strike, or should go immediately?
I always say go immediately. I mean, if you're going to make a difference, it's going to be because you've responded immediately. And if you, one of the safe places that you can be is in a metal vehicle. So if you're responding because you're driving there, then you've already got a safe place that you're in. I know that doesn't work in developing countries because maybe you're running to the scene. I think this is something we need to talk about with the lightning people that are on the board of directors of ACLENet and some of the other safety groups that we talk with. What are our recommendations specifically in this kind of a situation? So I appreciate your question. You know, what do we tell you? Because most of the time when you're responding, there's no place safe around. There aren't any lightning protected buildings. So I don't want you to become a victim too, but I don't know if there's much you can do about it. Because lightning's coming down, it's going to get you.
Then can someone be struck by lightning already?
If that was a question, I didn't understand it. Sorry.
We can't hear you well, Godwin.
I'm saying the question is, can someone be struck by lightning when there is no rain?
Can someone be struck by lightning when?
When there is no rain.
Oh yeah, absolutely. Absolutely. At least 10 or 15, 20% of lightning occurs when there is no rain in the area. Absolutely. Lightning can strike 10 or 15 kilometers away from the thundercloud. So don't wait for the rain. You know, lots of times you'll have a nice gentle rain and there's no thunder, and you don't need to tell the kids to be worried about normal rain. It's the thunders, and that's what I hear with the warnings that are taught to the kids is if there's rain, you're in danger. No, you're not in danger from a normal rain. You're in danger when there's a thunderstorm going on. If you can hear thunder, you're already in danger. That's why we say when thunder roars, go indoors in developed countries, but developed countries have lightning safe buildings. And we don't have lightning safe buildings throughout most of Uganda, particularly the rural areas. So there's no place people can go. It's one of the things we're trying to change. It may take us 10, 20, 30 years, but that's one of the things we're trying to change and get lightning protection as well as education. So people know so people can decrease their risk. Any other questions, Godwin? Barnabas?
Marianne, it's Ken here. There was another one in the chat about, can it be possible for a severely affected person to regain his or her memory fully in the long run? So I think that goes back to the brain question.
Yeah. For a severely injured person, one of the things that I see is that they get for the severely injured person or the person who has brain injury, often, like with other injuries, after a year or 2 or 3, you get used to working around that injury, and you learn to accommodate for the injury, whether it's a limp because you broke your leg, it's a scar because you had a burn, it's a lightning injury with the brain injury. And people often learn to accommodate or work around it. It may take a while. Will they ever recover all of their function? That varies with the person. They may or may not, or they may learn to work around it to the extent that people don't notice where their deficit is. And the people around them get used to it too. So, but no, sometimes, many times people do not recover, or don't recover fully to where they were pre-injury. But that does not mean they can still have a productive life. They can still enjoy their family. They can still have joyful times. They can still worship God. They can still do all the things that are important in their life, even if they haven't recovered completely.
There is a saying that when you hear thunder or lightning, when you lie flat on the ground, that it can save you. How possible is it? What is the possibility of saving you from lightning?
Very good question.
When you lie flat on.
Very good question. Okay. One of the questions was, if you hear thunder and lightning, thunder, will lying on the ground decrease your chances of being injured? Making yourself as small a target as you can can decrease your chances of injury by a small percent. It can unfortunately, with the ground current, we tell people not to lie down on the ground, because then that creates a long distance between their feet and their head. So it creates a potential difference, and those people are more likely to suffer injury. However, we can tell you to curl up in a little ball, whether you're up on your feet, squatting down, or you're rolled up in a little ball on the ground. And it can decrease the chances of injury. Yes. I can't tell you how much, but the smaller a target you are, the less likely you are to be injured or hit. Good question.
I am not seeing any question.
Okay. And we are over time at this point, so I appreciate everyone sticking around. Thanks to all who attended. This has been great. And if we'll go ahead and no more questions.
I am not seeing any question.
Okay.
Maybe,
very good. Then
if
let's break. I know it's
to,
getting late in Uganda.
If anyone wants to ask verbally here.
Well, you have my email, or Barnabas and Godwin can get you my email, and I'm on the WhatsApp Lightning Friends. So if you have questions, throw them in, email me, throw them in the WhatsApp chat, and I'll get you the answers. Okay. Thanks to everybody. Okay.
Thank you so much, Miranda, and everyone. Thank you for attending. We welcome you for more other webinars which are coming. We'll be alerting you all and telling you so that we can learn together. Thank you, and have a good night.
Thank you very much for organizing.
Okay.
Thank you,
Take
Mary
care.
Ann.
Okay.
Bye.
Bye-bye.
Bye.
Okay. Okay. Thanks to
Well done,
everyone.
Marianne. Yeah.
Okay.
Thank you.
Thanks, Ken. Okay. I hope I've gotten this turned off with the Zoom. I had the echo all the time I was lecturing, so.
Really? Oh, no. Oh, no. No.
I think
I've been there, done that before.
Yeah.
It's so
difficult.
disrupting. It's just, you know.
I think you had connected YouTube at the same time with the Zoom.
Yeah. I think it was probably on my end that it was that I was getting the feedback from the YouTube. Hopefully it didn't get onto the YouTube itself and create a set of echoes.
No, I don't think so. It was clear on my side. We can have a look through the thing.
Good.
I'm sure we can always edit the YouTube video, but you know, if
Well, let's hope so.
yeah.
So I wish they wouldn't update their software and make everything so confusing. Okay.
No comment. It's the constant pursuit for improved service. You know.
Okay. Anybody who wants to drop off, please feel free. Anybody who wants to stick around and talk, we can talk. No. Okay, you're muted, Barnabas.
Yeah. I'm just waiting to hear from anyone. Oh, welcome. There is this gentleman, Nwampe Naboth. He's a friend and a brother of mine. Welcome, Naboth.
Welcome.
You're muted. You're muted, Naboth.
Hey, Isaac. Okay.
Bye.
Okay. Oh, we're not getting anywhere, so. Okay. So I'm going to go ahead and end the Zoom now if we don't have anything more going on. Okay.
Sure. Thank you.
Okay.